everyone, I am Rebecca Hall with Happy Valley Bodyworks, and joining me is Dr. Emery Pitcel with Rothrock Chiropractic and Rehabilitation.
Yes, sir.
So we are super excited. We talked a little bit earlier in the month about the pectoralis complex. So today we're going to show you just a couple techniques that I really like for pec major and pec minor to utilize to just kind of get things to relax a little bit more. So Dr. Emery has been super kind and gracious enough to help me out with this. So I'm going to have you lay on your back here.
Yeah, absolutely.
To start.
Happy to be here. All right. On the back, face up, right?
Yes, sir. All right. And then, oops, wrong way. Sorry.
Red goes up, yellow goes down.
Got it.
Yep.
All right. So I'm short, so it happens. All right. So the first thing that I'm going to do is talk about the pec major release, right? So our pec major, right, kind of comes along here, runs along to his chest. So what I'm going to do, and I always like to shorten the muscle as I'm trying to work on it, right? Because I could bring you out here and then really strip through that pec major, but it's going to feel really uncomfortable. And I think 9 times out of 10, I can get the same amount of work done and not have my patient crying on the table. So I'd rather do that. So what I do is I just kind of grip right around that. I'll shorten him enough that I can kind of feel that pec major. And then I just bring him a little bit across his body. You okay with that so far?
I am, yeah.
Okay. Too much, or do I need to go a little bit further?
You can go a little further, actually, if you
Okay.
don't mind. Yeah.
No, not at all.
And a little more clamp would be okay, too.
Okay. Yep. So I just kind of work down. So he's got a little bit more tension right through the middle to like kind of moving in towards his body a little bit. So I'm just kind of working through that. And all I'm doing is just doing like a trigger point hold and then pulling his arm across to kind of shorten that muscle. And then once I feel this release, then you can kind of slowly bring it out, see how far we can get, right? And then I might work down a little bit into the muscle, do a couple more, do a 10, 15 second hold, bring him out, relax, and then see. But a lot of times once I bring him out here, I'm just going to look where his shoulder goes without me pressing on it, because that's going to automatically bring him more in.
Yeah.
And I can do that on this side too so that people can see. I think I'm going to do it this way.
If I could interject as well too, it's like anytime you're doing massage technique and you get like under the muscleability of the pec, like it's really sensitive there.
It is.
So I do really like that you prefer to do more like shortening in trigger point release than elongating, because like it already is just intense enough. Just almost setting up the position, quite honestly.
Yeah, definitely. So I'm going to show you just for vision's sake from here, but I'm grabbing his pec muscle here and then just bringing that arm right across. Are you okay with that?
Yep.
Perfect. Yeah. And this one is a little bit nicer of a technique because the pec major is bigger, so it's easier to grab a hold of. It's not super as hypersensitive. The next one is a little bit more of a sensitive area. So your pec minor can be really, really taut and really, really tense. So I always tell people, like, please tell me if it's too uncomfortable.
Mm-hmm.
The other thing that I'll sometimes do is watch fingernails. Because if you have really long nails, this is not a technique you want to try on a client, because you're going to dig right into them and it's going to be really painful. So grab a towel, grab something, right? Sometimes I'll just use like the sheet to kind of act as a barrier, just to kind of help prevent you from just like stabbing them with your nails.
Absolutely.
You have a shirt on, so this helps a little bit, and I'll try and be gentle with this. But basically, you're going to come under that pec major, right? Kind of in that armpit area. And then I always work my hand a little bit down and in. And then again, shortening that a little bit. You doing okay with that?
Yeah, see, this is the opposite, where it's like, yeah, you might want to lighten up just a tad.
Yep. So, and again, I always touch base with my clients, or I'm watching their face, because a lot of times this is a very telling one. It's a pretty sensitive area. And a lot of times people get super tight with this. So again, you don't have to do a ton of movement. I usually don't do a lot of movement with this one in particular. Pec major, I might play with it a little bit more. Pec minor, I usually just do a straight trigger point, because it can be very, very sensitive, very uncomfortable. And I'm going to get the same result as long as they're just breathing and relaxing. And you're already starting to relax a little bit. I don't know if you can feel that.
No, I can definitely feel that it's calming down.
Yeah. So even with that, 10-second hold or whatever we just had there, super easy to relax that guy. And then you get so much more motion in that capacity. So moving to the other side, right? I'm going to use this hand. I always like to have my outer hand control the arm. It doesn't really matter. You can do it either way, whatever's more comfortable for you. But I'm just going to kind of come up and in underneath the pec, into that pec minor, and then bring his arm across just like that.
this side's not as bad.
Yeah, you're definitely, your dominant side's more your right side for sure.
Yep.
But yeah, and then you just hold that. You can relax, do it a couple times. Usually I'll do 2 to 3 times depending on how tight they are. Mm-hmm. And then kind of reassess, and then we can go through some of our other stretching and everything like that. But that's what I got for you today in terms of that. So I'll help you get up off the table here if you'd like. Thanks for being my demo today.
Yeah, thank you. Thank you.
Absolutely. But yeah, so that's a short and sweet version of our pec releases that I do along with some other things at Happy Valley. But again, I'm Rebecca Hall with Happy Valley Bodyworks, joined by Dr. Emery Pitcel here at Rothrock Chiropractic and Rehabilitation. Have a great May. If you enjoyed this, please like, subscribe, leave a comment, let us know what else you want to learn about. We're happy to take suggestions if we need to, and we'll see you next time.
Yeah, thank you, everybody.
Thanks.